Vitamin D, the sunshine vitamin. So let's start. Let me just say with vitamin D, it is a lot harder to find a lot of information on vitamin D. So if you do have any questions, I definitely would have to probably dive into it deeper or find those information about vitamin D, but it's definitely a tougher topic to find information for. So let's go ahead and go through this and see if this is at least helpful for you. Okay, so the best way to get vitamin D is to expose yourself to natural sunlight. So vitamin D is called the sunshine vitamin. So your skin is exposed to UVB rays. The vitamin is activated by your liver and kidneys. So another way to get vitamin D into your system is a supplement, vitamin D3. So a lot of people will take a supplement when natural sunlight is not an option for them. Right now, we still see some sun here and there in this area, but obviously in those winter months, that sunlight's a little bit tougher to get. So you want to, so taking an oral supplement may be something that you could consider doing. Okay, this is just a little bit about the vitamin D. It's stored in the body for a longer period of time. So vitamin D uses fat to store in your body. These are some other vitamins that do: A, D, E, and K. This is just a little background on vitamin D. It works like a hormone, so it helps to absorb calcium and distribute that throughout the body. So we all know how valuable calcium is to our body as well. No other vitamin goes through the process of activation by the liver and kidneys than vitamin D does before it can be used in our body. So why do we need vitamin D? Okay, so vitamin D does a lot, actually. It helps with bone strength, helps to regulate hunger, fall prevention, helps to prevent cancer growth, improves your mood, mental performance, regulates blood pressure and heart health, and helps to improve your immune system. So those are all super valuable reasons why vitamin D is important to you. A big one is the bone strength. So it aids in the calcium absorption and maintaining bone mass. So when you have low levels of that vitamin D, that's when your bones could become thin, brittle, or mishappen. So that's when those falls take place, which just cause issues as well. After a certain age, I believe it's 65, you may be advised to have a bone density scan from your doctor to kind of see where you're at with your bone strength. Another big one is for the immune system. So this is just about the different cells and how they're secreted and what they do, the cytokines. Vitamin D is involved in producing these cytokines. So it is beneficial to your immune system to have that vitamin D to help to produce these cytokines. They move towards sites of inflammation, infection, and trauma. We do give people in the hospital, when they have, let's say, COVID, because I know that's a big topic, vitamin D is one of the vitamins along with zinc that people do take. That's one of our treatments. So it's obviously an important part of helping with your immune system. So people want to know, am I deficient in vitamin D? A lot of Americans are insufficient in vitamin D, 85%. So the only way to accurately know if you are deficient is to have a vitamin D test. It's called the 25-hydroxy vitamin D blood test. A lot of people, it's not on their regular blood work that you get when you go for a physical. You get a lot of your blood work checked. This is something that you may have to ask your doctor if they can check for you, or double check that it's on your script to be checked. I put the levels in there. The 20 nanograms per milliliter to 100 is considered adequate for healthy people. One of the classes I had done before, somebody had mentioned that they had some kind of copay for the vitamin D test. Again, I don't know everyone's insurances. You could always check with your insurance company, or your doctor may know. But again, that's the blood test that you would need to determine whether or not you're low in vitamin D. So if you have a physical coming up, or you just want to know, you would have to ask your doctor to write a script for that. So basically everybody's at risk for low vitamin D, especially in the winter months. Darker skinned people, pregnant women, and the elderly population, which we'll go into a little bit more as the slides go on. It's just the fact that we don't live somewhere where there's a lot of sunshine all the months throughout, every month throughout the year. Some of the reasons why is not only the weather or where you live, increased industrialization, tall buildings, and pollution. They block, excuse me, those UVB rays. Sunblock and clothing to block the rays, and fear of skin cancer has caused people to avoid the sun. When you're out in the sun, you don't need to expose a lot of your skin in order for that sun to come in. If you're mowing the lawn and you like to wear a hat and maybe like a long shirt, even if it's just your hands, that UV rays is going through into your skin. Even if it's your hands or your back or your neck or whatnot. So obviously if you use some kind of sunblock, it may not be as strong coming in, but you, like I mentioned, you don't have to have a lot of your body exposed in order for you to get those, get the vitamin D. And I think I have on the next slide, I know downward more, we'll talk a little bit how long you have to be out in the sun. So if you're somebody that has low vitamin D, these are some of the risks. You can get arterial stiffness, which is going to, when it affects your heart, increases your risk of heart attack. It's just that the arteries are becoming hardened. So that would cause the blood flow not to flow as well. Bone pain, osteomalacia, osteoporosis, cancer, stroke, and rickets. If you're a little bit low in vitamin D, it can be corrected. But again, if it's something that you're never checking and you don't know, then these are some things that could possibly potentially happen. So you'd want to definitely know where you're at with that number. Okay. How much vitamin D do I need? So only 10 to 15 minutes of sun twice a week is what you need in order to get a nice level of vitamin D. So it's not a ton of time out in the sun. You don't have to lay out there for hours at no end. Just a few minutes twice a week will get you that amount that you need. Obviously, different factors to play into it: time of day, your location, the season, the clouds, the amount of skin that's exposed, and skin color all will impact the amount required as well. If you're somebody that would like to take a supplement, I always recommend you to talk to your doctor first. I don't know if vitamin D interacts with certain medications or causes things. So that's always a conversation to have with your doctor. Even though you can buy vitamin D at the store, I would recommend still asking your doctor. You want to get the vitamin that says vitamin D3. 2,000 international units a day is sort of the recommended amount. If you get a vitamin D2, you need the sunlight to convert it. So if you're somebody in the winter months that doesn't go outside a lot, you don't get to see the sun, we never really do in the winter, you're going to want to pick the vitamin D3. So when you're out in the sun, your skin produces 10,000 international units in 30 minutes. So you're getting well enough vitamin D if you're outside for a few minutes twice a week. I had mentioned that vitamin D is absorbed by fat. So if you are taking in a supplement, you can eat it with a healthy fat. Avocado, nuts, coconut oil, or olive oil will help to your body to absorb the vitamin D better. So just keep that in mind if you're eating it or you're taking a supplement and you want to eat something, maybe like a handful of nuts will help to absorb it better. So there's some foods with vitamin D in it. Foods in nature, there's not a ton. Wild caught salmon, mushrooms, which I'm not sure which mushrooms or anything like that, liver, and egg yolks. There's fortified foods where they put the vitamin D in: milk, yogurt, cheese, margarine, orange juice, some breads and cereals, which is okay too, but you're really not going to get enough vitamin D by eating these foods. You really need to see the sunlight or possibly take a supplement if you're not able to be out in the sun as much. I always look for more foods and I really can't find too many. So unfortunately, this is kind of the list that I've stuck with. The reason we had mentioned the elderly population is they may have a low vitamin D intake with the foods, less sunlight exposure, especially those in assisted living. They may, especially if there's somebody you know, they're not able to get outside and everything with COVID and these past restrictions, these past few years, I'm sure it's been difficult for a lot of people and in these assisted living homes to get out with their family and maybe come back. I'm sure it's been difficult. So that's another reason. And as you get older, your body's ability to make vitamin D from the sunlight decreases. So those are a few reasons why the elderly population may be more at risk for lower vitamin D levels. And that's why it's important to have that level checked to kind of see where you're at. Sometimes in the summer, your level may be different than over the winter months. So you may not, your doctor may not think you need a supplement, or you may not take a supplement, but over those winter months, you may take something. So that's, again, a conversation that you'd want to have with your doctor as far as what they recommend. So again, to prevent vitamin D, if you're not getting enough sun, you can eat those foods rich in vitamin D. There's not a ton, but you can have some. Or you can talk to your doctor about taking supplements. Can I get too much vitamin D? Yes, but it's uncommon. So some people have to take higher doses of vitamin D. When I did this before, there was a woman that was battling cancer. So her doctor, she was taking 50,000 a day for several months. I don't encourage anybody to go out and just take high doses of anything. Talk to your doctor. That 2,000 is kind of a basic amount. There's certain circumstances where your doctor may prescribe a higher amount, but that is a conversation to have with your doctor. Having too much vitamin D can calcify the liver, the kidney, the heart, the lungs, and the eardrums, leading to deafness. So you just want to be careful on what you're taking. The symptoms for high levels of vitamin D are headache and nausea, which we all know is basically a symptom for everything. So you're really it's not really going to stick out if you're taking too much vitamin D. You really cannot get too much vitamin D by the sun or by food. So the most common way to get too much, if it happens, would be by the supplement. Okay, so I had mentioned that this PowerPoint, the vitamin D is a tougher topic to find tons of information on, so it's not as long as some of my other ones. If you have questions, I can try to answer them the best I can. So I don't know, I think I saw something pop up or.
I'm seeing a couple different things. I was trying to help people navigate some stuff. But one of the questions I'm seeing about vitamin D is, does sunlight through a window count?
So no, because I actually have had that question before too. People are like, well, what if I'm in the car driving and whatnot? So the sun's still going to be blocked by that window somewhat. So it's definitely not as, it's definitely not coming through like as if you were actually out in the sun. And another question people had before are those sun lamps for people that have that, oh my gosh, I always forget every time I do this, that seasonal depression type of thing. They have those sun lamps and things. Those aren't effective either. So it's definitely has to be like the natural sunlight coming through.
Okay, thanks. Yeah, we actually have a question about seasonal affective disorder. Somebody's wondering if a vitamin D supplement can help with that.
I think the vitamin D supplement can definitely help you to feel better in different ways. As far as increasing your vitamin D level, the best way would just be to do the sunlight or the supplement. If you're taking your vitamins and you're eating healthy and you're probably going to feel better in general. But if you're looking to get that number in a certain level, in certain range, you would have to use the supplement or the natural sun.
Okay, thanks, Darce. This next thing is, so if I have sunblock on, I need to be out in the sun longer than 15 or 20 minutes. Am I understanding that correctly?
Yeah, I think it depends on the level of sunblock too. There's obviously, I think 30, 50, there probably is something higher. I'm not really positive. But yeah, I would say anything stronger, you may have to be out in the sun a little bit more for you to get the right amount of vitamin D. So that's one of those factors that I had mentioned. Let's see, I think I can go back to that. The duration of time, skin colors. I probably should put sunblock on there too. That can also affect it as well. So yeah, probably a little bit more, but you're still going to get some of that vitamin D through it, through your skin regardless.
Okay, thanks. This next question is it critical to use certain vitamin D brands? Much of the literature suggests to get as pure a supplement as possible. How can we find that information?
So probably talking to the pharmacist, they would probably be able to recommend the best brand for you. I have a vitamin D3. I think it's just one of those nature brands. Some of the vitamins I take are the store brands too. But if you're really curious about the best brand, you can always talk to your doctor. But I would say when you're at the pharmacy, just ask them what they recommend. If there's a better brand or if it's better to take a certain type, then I would definitely do that. They should be able to guide you on the most effective vitamin D supplement.
That's good advice. And a plug for next week, Tuesday the 26th at the Cheektowaga Senior Center. So it's an in-person class at Cheektowaga. We have Mark Leonard, who's a pharmacist with Mobile Primary. He'll be giving his presentation all about supplements. So
that would be a good
person.
Yeah.
Yeah, if you want to go, you have to call the Cheektowaga Senior Center to register, and their number is 686-3930, and see if there's still space.
Do they do, on a side note with that too, I'm just wondering, I'm not sure. Do they do a live stream of that too? Or
I'm
like a
not quite
recording for
there
people
yet.
Yeah, I'm just
Working on it,
curious if for
though.
people that can't make it,
Mhm.
if there's like, you know how you link this up onto the site, if there's a way they do that as well, that might be helpful, but
Thanks,
that would be a
Darcie.
good one to go to because pharmacists are just the best people to obviously talk to about vitamins and supplements, anything. I always recommend.
This next thing is, just so you know, my doctor told me to take my calcium with my vitamin D, but not with iron for proper absorption.
Wow, that's good to know. See, thank you. That was very helpful. And that just goes to the point of making sure you talk to your doctor because everybody's on different medications and different things. So that's really good information to know that this person obviously couldn't take it with the iron. So that's very helpful. Thank you.
Looks like my video is being a little finicky here. Okay, so I'm not seeing any other vitamin D questions right now. We'll give it a second, but I do have a blood pressure medication question for you, Darcie, if I can ask it.
Sure.
Okay, so this is, can taking lisinopril over many years cause hoarseness?
Hoarseness, like in your voice?
I think so.
So I would have to actually look that specific medication up to see if that's possibly one of the side effects. I wouldn't doubt if there's a side effect of long-term use. There's so many listed. But again, like that's a great question for a pharmacist as well. I have looked up medications before and sometimes the lists are just endless. But definitely you can ask your doctor or the pharmacist. And I remember one time I was taking a medication for not related to that, but something different. And I kept getting a lot of like numbness and tingling in my hands. And it turns out that was a side effect of this medication that I had never known. So I'm not on that anymore. But again, like I don't know if that's specifically for that, but I would definitely be asking the pharmacist if they know of any long-term side effects for sure.
Thanks for that, Darcie. I'm not seeing anything else come through. We'll give it another second, but Darcie will be back with us on Tuesday, December 7th for her high blood pressure presentation. We'll finish that up, so we hope you can join us. That's at 10:30. It'll be here virtually. You can register on our website. And I'm just seeing thank yous. I'm seeing thank you for both presentations. Thank you for the
I'm sorry.
information.
I know.
No, it's on both of us, but you know what? We got the information out there, Darcie, and I appreciate you. So thank you.
Well, thank you, everybody. Thank you. Have a great rest of the day.
All right, bye.